Interim report.
The member for Macquarie.
I move the motion relating to the Royal Commission into Aged Care Quality and Safety Interim Report in the terms in which it appears on the notice paper.
Member for Macquarie.
Deputy Speaker, with their own Royal Commission describing as neglect the Morrison government's failure to provide more home care packages to support elderly Australians staying in their own home, you know you're facing a crisis. The commissioners in their interim report say they can't see any reason why action should be delayed in this area. And in two other areas, the over-reliance on chemical restraint in aged care and the appalling situation of younger people with a disability going into aged care. And if members have spoken to anyone involved in the sector, from residents to family members to staff, volunteers and even operators, you could have predicted that we are well overdue for some tangible action in each of these areas. Yet you could almost blink and miss the government's response on in-home care. A mere 10,000 additional home care packages have been announced. Let's put this in perspective. There are 120,000 older Australians waiting for home care. They've been assessed, they've been approved. Now, what they're waiting for is a package to be available. Now, what does that actually mean? It means someone who currently has a package at the level that they require has to either go into an aged care facility and no longer need that package, or if they die, the package becomes available. That's what people on the waiting list are waiting for, in lieu of a significant additional investment by this government. There is simply not sufficient funding in the home care package system to meet the need, and 10,000 makes such a tiny difference. I recall when a similar announcement was made about a small increase in the number of available packages, and Thelma from Blaxland, who's in her mid-90s, called me to say she'd naively thought it might improve her chances of receiving the small amount of assistance that she requires, a level 1 package. She said she'd phoned the department to see if it would make any difference to the year-long wait that she'd been told to expect, and they broke the news to her that it wouldn't make any difference, none at all. There is no guarantee that this latest miserly package will make a difference either. When I last spoke with Thelma, she was still waiting, joking that she'd be dead before it came through. But sadly, that isn't a joke, because 16,000 elderly people had died in just 1 year waiting for home care. I think what angers me most is the rhetoric from this Prime Minister about how he values older Australians, and yet his actions do not match his words. In his first budget as Treasurer, this was the man who ripped $1.12 billion from aged care. This is the man who failed to act as the waiting lists for home care grew from 88,000 to 120,000. And this is the man who ignores advice from the Department of Health only as recently as April, in the lead up to the last budget, that provided advice on how to fix the home care crisis, yet did absolutely nothing. It's a similar story for the efforts being made to address the issue of younger people in aged care. The Morrison government less than a month ago claimed it was doing enough, despite the Royal Commission's demand for increased action. The Minister for NDIS must have missed the criticism of the government, as the commissioners described the issue as a national embarrassment and a human rights issue. How's this for an assessment of the government's action plan released in March? Significant gaps, lacks ambition, and should not be relied on as a solution. The Commission's words, not mine. We will be closely monitoring the response of this government to the overuse of chemical restraints to ensure that it is actually an effective response. I personally believe there's going to need to be a much more significant approach to change the practices in aged care facilities, and I believe they'll go to the heart of staffing levels and resources. And I want to finish on that point. Aged care operators themselves tell me that it is really tough to run a high-quality operation with the cuts to ACFI funding that mean facilities have to do the same with less. More able residents raise issues with me about things like the quality of food and general standards. And I've heard a steady flow of feedback about the quality of places available around the state from families currently looking for suitable residential care for either a partner or a parent. Clearly, we are not consistently treating elderly people with respect and dignity, and the stories of the Royal Commission tell us that in too many cases it is not even humane. The government can't just do enough, it has to do more than that.